facelifting, big part of what you do.
Yeah.
At what point does somebody need a facelift?
Well, I'm going to put facelift as one of my many tools for facial rejuvenation. Okay, and a facelift, people make that mistake of facelift versus a full facelift. A facelift is really a neck and jowl lift, and it's very reliable and reproducible removal of the jowl and the turkey neck. Okay, so that's what a facelift does. It does this part of the face, the lower third. And you know, when I first started practice, I kind of had one facelift, and now over all these years, I've been in practice 20 years, I have like 5 different facelifts. So I try to match that facelift with the patient's anatomy. So I would say I do a lot of mini facelifts. We call it the Petit Lift. And the difference between a mini facelift and you know, a very aggressive facelift is dissection, how much skin you undermine. In a mini facelift, it would be less. The less you undermine, the quicker the recovery. There are some people who come in with bowl-shaped necks, and they have big submandibular glands and a thick neck. You can't do a mini lift on them, and if you do, you're really wasting their time and your time. And so the spectrum is from a mini lift to actually full neck contouring with removal of what we call the platysmal fat, and underneath the platysmal fat, removal of these glands called submandibular glands. There's these big, thick muscles called digastric muscles. So on some people, I'll actually remove part of the digastric muscle, remove part of the submandibular gland, remove part of that submandibular fat, and then suture this platysmal muscle, and they can go from kind of a bowl-shaped neck where the chin meets their chest to a very contoured, defined neck.
So what are the age ranges of these, like these mini lifts?
Yeah, most people, I would say in the late 40s is when they start doing mini lifts. Usually eyelids and brow lifts are in the late 30s and early 40s, and then mini lifts in the late 40s, 50s, 60s, even into the 70s.
Okay, and how many years younger can you make somebody look with some of these?
God, it really depends.
What do you hear?
It depends on
like
their
10
anatomy.
years younger,
yeah,
15
I would
years
say
younger?
10 to 15, and it really depends on how fit they are. I always tell patients the best thing for your skin is cardio. Avoiding sun, avoiding smoking, and cardio. So if somebody does that and lives a healthy lifestyle, yeah, they can look 15 years longer. I just did you know, funny you should mention that. I just did a lady, and it surprised me how good she did. She's actually my age. She was a heavy smoker. She was a patient of mine, I don't know, 12 years ago, and she came back for a facelift, and she looked pretty bad. A lot of sun damage, a lot of smoking, and I just did her facelift about 3 weeks ago, and honest to God, now this is unusual, but she looks about 20 years younger. I mean,
Is that right?
Yeah, it's actually quite impressive transformation.
Now, what are the fears patients have? Because I feel like I could spot a facelift 20 yards away.
That's their fear. That's their fear. So for brow lifts, every one of them says, I don't want to look like a deer in the headlights, okay? And that, you know, if I had patients that looked like that, it wouldn't be very good for business, but we don't see that. But, you know, you do see it. You see it. And
that done look.
That done look.
Tight,
and all you have to
look.
do is see one of them, and it negates 100. And the same thing with the facelift is, I don't want to look windblown, right? I don't want to look like that tight windblown look. And I usually tell people that windblown tight look is either one of two things: inexpert surgery. So if you're a pro at it and you are detail oriented on how the earlobe insets, where the sideburn is, how you treat the posterior hairline so they can wear their hair up, that you're not pulling on the skin, because the skin will stretch. You're pulling on what we call the SMAS layer, which is the superficial covering of the muscle. It's very fibrous, doesn't stretch like the skin. If you do the right things, you won't get that look. The other way is some people, you know, they've had 5, 6 facelifts. After 5, 6 facelifts, you'll have that look. So I try to caution my patients to have a life plan on how many they're going to have, how long the facelifts last, and if it's done expertly, you should not be able to tell that they had a facelift.
Are there women out there in San Diego, they're 60, 55, that look years younger, nobody knows they had a facelift, not even their friends?
Most of my patients. Yeah.
Really?
Most of my patients.
So if I saw one of your patients walking down the street...
You wouldn't know. You shouldn't be able to know. I'd be embarrassed if you knew. You shouldn't
So
know.
when I see somebody looks fantastic at 55, I'm going to think, maybe that's Dr. Chasan's patient.
I hope so. Yeah, I pride myself on that.
Good for you.